Now, bipolar disorder, we have moved on to psychosis, and the idea of going through that is to better understand. And when you see the symptoms present again in certain disorders, then you have an idea that, okay, psychosis is part of what they experience, and these are the symptoms that I should see: delusions, hallucinations, and thought disorganization. Now, what is it about bipolar? The best way to remember bipolar disorder is it's two sides of a coin, basically. Bipolar, you can think of the North Pole and the South Pole, two extremes. Now, the patient is either extremely elated, so the emotions is quite heightened on one end of the spectrum, and then on the other, the emotions are quite low. So you have low mood. So you have elevated emotions, which is mania or hypomania, and then you have low mood, which is depression. So we can look at it like heads or tails, up or down, North Pole or South Pole. So one extreme or the other. So heads is the elevated mood and tails is the low mood. And there are two types. There is mania and there is hypomania. So with both of them, mania comes with depression, and hypomania also comes with depression as well. So mania is the severe form, and this usually requires hospitalization. Hypomania, on the other hand, doesn't usually disrupt the person's day-to-day activities. So it's a lesser form, and it also comes with depression as well, but can be managed outside the hospital. Now I put the treatment antipsychotic lithium. Lithium is not the first thing you're going to go for. You're going to go for cognitive behavioral therapy, but as we break it down, we'll understand when we're supposed to go for that first. But the major thing for bipolar disorder and the questions that usually come out has to do with lithium toxicity, the therapeutic dose, which is what we went, or which is one of the topics that we took the last time. But we're going to see some of the mnemonics to help remember the lithium toxicity and some of the things that we're worried about. Now we move on. What do you need to watch out for in a patient with bipolar disorder? So were they previously on antidepressants? So this can also be asked because if the patient did not have bipolar disorder, but they are at risk, and we're going to look at what the risk factors are. If they are at risk of having bipolar and they are placed on antidepressants, it's important to know because you have to discontinue the other types of antidepressants that they're on to be able to treat them, to begin to treat them on the treatment for bipolar. Then we have medication toxicity, which is lithium. So that's the other part that you also have to pay attention to when it comes to bipolar disorder. Then neuroleptic malignant syndrome, which we treated the last time, which presents with the toxicity of the use of medications. Now, moving on, what is bipolar characterized by? Like I mentioned earlier, it's characterized by depression and mania. Depression, you have periods of prolonged and profound low moods. And you also have, which the depression alternates with mania, which is the other side of the coin, which is the elevated emotions, which is periods of excessively elated and irritable mood. So they could be extremely happy at one point. They could be excited about life, love everybody, spend on everybody, go on a shopping spree. This is the other extreme. Okay, so we are going to look at the differences between mania and hypomania, which is bipolar 1 and bipolar 2. So to be able to make a diagnosis for bipolar 1, which is mania, at least the person should have experienced the symptoms for at least 1 week. But for hypomania is like 4 days or less than 4 days. So for mania, you have the decreased need for sleep, you have pressured speech, you have increased libido. So they're quite sexually active. That is the extreme part of the spectrum as well. Activity, agitation, increased libido. Then reckless behavior without regard for the consequences. This is the extreme also. Grandiosity, their behavior, they believe that they are maybe a very important personality, somebody who is important, they're the king of a country, and they go around actually acting like that as well. Then they're more talkative than usual. So they say a lot. The words may not make sense, but they keep talking. And you have something similar also in hypomania. So there are some symptoms that you see both in mania and hypomania. But the major difference is the duration of the symptoms. Now, for mania, we also have marked impairment in social and occupational functioning. So you can get to a point that the extreme of their symptoms can actually bring about self harm or harm to others. And this is a situation whereby if the patient is refusing to come for treatment, you can actually use the Mental Health Act in a situation like this. For hypomania, you also have unusually high energy levels, inflated self esteem, is one of the other things. Extreme happiness or excitability, which you also see in mania, lasts for at least 4 days. It also has rapid speech. They get very easily distracted. That means they can't focus, but it's not as severe as in mania. Now, symptoms are not as severe enough to affect their daily functioning or cause them to be hospitalized. So, those are the things that you have to remember about mania and hypomania. Okay, so what are the risk factors? And this also comes in the question, the risk factors for individuals to develop bipolar disorder. Now, genetics is one of them, having a first degree family member. So it predisposes them to 10 times the possibility of actually having the illness. And then having one parent is about 15 to 30%. Having two parents who have a history of it predisposes to about 50 to 75%. So, two parents increases the risk of actually developing the disease. Now, with male and female, we've noticed that it happens equally. Then, usually, the onset of bipolar disorder is around the late adolescence and early adulthood. Some other things can predispose, which is environmental factors, stressors, things like maybe death of a relative or illness or having trouble with relationships or even finances as well can predispose.